Ever feel like your healthcare was designed for, well, someone else? Today, we're diving headfirst into the revolution that's happening with our personal health data. It's a story with incredible promise, for sure, but also some pretty serious peril.
Right, so let's get into this. For the longest time, medicine has been built around this idea of the average patient. But here's the thing, as the All of Us research program points out, that just doesn't work for most people. I mean, you're not average, right? So why should your healthcare be?
And this really breaks it down perfectly. Over on the left, you've got the old way, treatments for the average, a lot of trial and error. But on the right, that's the future, precision medicine. We're talking about healthcare that's completely customized to you, factoring in everything from your genetics to where you live. The whole idea is to get the right treatment to the right person the very first time.
So how in the world do we get there? Well, here's the deal. We need data. And not just a little data, we need a lot of data. The best way to think about it is that we're building the world's most important library, a library of human health.
And this isn't just some far-off idea. It's actually happening right now. There's a huge project called the All of Us research program, and they are leading the charge to create this massive, super diverse database. The goal? Get health data from 1 million or more people so we can finally make truly individual healthcare a reality for everyone.
I mean, just imagine the possibilities here. With this kind of data library, we could finally figure out exactly which treatments work best for people from all different backgrounds. We could spot disease risks way before they become a real problem, and even figure out how technology can help us all lead healthier lives. The potential is, and I'm not exaggerating, absolutely staggering.
But, and this is a big but, collecting all of this incredibly sensitive information creates a huge dilemma. You know, with all this incredible power to heal comes an immense responsibility to protect.
This is not a new problem, by the way. This idea of medical privacy is ancient. It's baked right into the Hippocratic Oath, from way back in 400 BC. The real challenge we face today is figuring out how to keep that timeless promise in our digital world of giant databases and instant communication. Okay, so to really get this, we need to be on the same page with a few key ideas. First up is privacy. This is your fundamental right to control who gets to see information about you. Plain and simple, it's all about the person.
Then there's confidentiality. This is the duty that your doctors and hospitals have. It's their responsibility to protect the information you give them. So if privacy is about you, the person, confidentiality is all about protecting your data.
And finally, we've got security. This is the how. These are the actual tools and the rules. You know, the firewalls, the encryption, the security policies that are put in place to actually make privacy and confidentiality happen. It's all about the safeguards. Now, what's so fascinating here is the paradox this reveals. A huge number of us, 84%, feel pretty confident our records are safe with our doctor, and yet 2/3 of us get nervous the second that data starts getting moved around electronically. It really shows that we trust the person, but we're a little wary of the system.
So how do we manage that system? Well, in the US, it pretty much all comes down to one major law that acts as the official playbook for all things health data.
And that playbook is called HIPAA. It's the law that sets the national standards for protecting our most sensitive health information. It makes sure that it can't be shared without our say-so. You can think of it as the foundational law of the land when it comes to your health privacy.
And HIPAA is really built on 3 big pillars. First, you have the privacy rule, which basically says who is and who is not allowed to see your information. Then there's the security rule, which lays out exactly how that electronic info must be protected. And finally, the breach notification rule, which makes sure that if something bad does happen, they have to tell you and the government about it.
Okay, so we've got the incredible promise of precision medicine, and we've got the rules in place to protect the data. But there's still one more massive hurdle: actually getting your hands on your own health information.
Yeah, this problem has a name. It's called information blocking. This is basically any practice that deliberately makes it hard for you to access or share your own health data. For way too long, a lot of systems are basically designed to hold your data hostage, making it nearly impossible for you or even your other doctors to get a complete picture of your health. So what's the solution? Well, it's a piece of technology called an API. Just think of it like a universal secure key. It's a standard way for different computer systems to talk to each other, so your new doctor system can securely ask for and get your records from your old one, or so an app on your phone can pull in your latest lab results automatically. And get this isn't just a cool tech trend. It is now the law. A piece of legislation called the 21st Century Cures Act directly goes after information blocking and requires the use of these open APIs.
The entire goal is to finally put you, the patient, in the driver's seat, giving you full control over your own health story.
And that really brings us to the core conflict, doesn't it? On one side, the promise is just incredible. We're talking individualized care, huge research breakthroughs, and real patient empowerment. But on the other side, the peril is also very real. Privacy risks, the potential for data misuse, and that ongoing fight against information blocking. And just so you know how serious this is, the government can now fine companies up to $1 million, and that's per violation, for deliberately blocking you from accessing your health data. That is a massive incentive to finally do the right thing. So here's the bottom line. The technology and the laws are finally starting to line up to put the control of your health data exactly where it belongs, with you. So the big question isn't just what researchers or doctors are going to do anymore, it's about what all of us will do. With this new power, what kind of future are you going to help build?